Hello and welcome to my conversations coping with COVID. Through the course of these conversations, we have stayed close to government guidelines, keeping you informed about the changes and visiting relevant businesses so that they can reassure us of their plans to keep us and their staff safe. But as a result of the isolation, we have all suffered. It seems that many residents may be concerned about their physical health, but still nervous about leaving home to seek help. Today, I'm talking to Georgina Bull from Nene Valley Osteopathy. Georgina is a practitioner based on Raunds High Street and working with those who have muscle and joint problems and pain. Also joining us today is Sonia James. Sonia is a member of the East Northants First Responders team. They are the people who arrive first following a 999 call. You will, I'm sure, have noticed the yellow boxes which contain defibrillators around the town. First responders are responsible for the defibrillators, which have proved themselves invaluable in emergency situations. To learn more about osteopathy and first responders, let's start by asking Sonia for an overview of her organisation. Sonia.
Good morning. Okay, so East Northants First Responders, we are a group of volunteers we are trained by East Midlands Ambulance Service. We attend 999 calls in the community, arriving before the ambulance. We provide life-saving treatments and emergency care. We're scattered across East Northants and collectively respond in the community to 999 calls. As Sylvia said, we also install and maintain public access defibrillators across the region. And since these have been installed, survival rates from cardiac arrests have increased, which is fantastic. So this is a defibrillator. These are the ones that you will see, or similar models to this you will see in the yellow boxes. They are extremely easy to use, so should you need to get one, they will basically give you the instructions. They will talk to you, they will show you where to put the pads and give you full instructions of how to use.
Good, good. Thank you very much. And so over to you then, Georgina.
Hi, I'm Georgina. I'm an osteopath, and I know not many people understand what an osteopath is. We're very similar to physiotherapy, so we use hands-on treatment, soft tissue massage, joint mobilisations, taking joints through ranges of motion to improve how joints are working, to try and reduce painful conditions. We are frontline, we are private health, so you are welcome to come and see us without seeing your GP first. We have made quite a lot of big changes since March the 23rd. COVID has made some massive changes. We have to put a minimum amount of time between customers to allow full change of protective equipment that we're wearing. We're wearing face masks, we're wearing aprons, we're wearing gloves. Everything in clinic gets disinfected between each and every customer without fail. We are making sure that everything is absolutely 100% in terms of hygiene, and that the room itself is aired, ready, so that all particles have settled before the next customer comes in.
Oh gosh, and how about you, Sonia? What sort of work have you been doing?
During since the 23rd of March, we've been very active within the community. As a group, we collectively responded to a variety of 999 calls, so we were still all responding throughout coronavirus. If we attended a call, obviously we would be wearing PPE. This involved mask, apron, gloves. On a larger scale, we were working in a very large group, ensuring that ambulances had sufficient PPE. So this meant we would be going around the stations, delivering PPE to the front line. As a group in East Northants Responders, we also were very active with collecting prescriptions and delivering food parcels to those that weren't able to get out or didn't feel safe to go out in the community during the lockdown period.
Okay, and how many responders do you have in East Northants? Because you see yourself as that geography, don't you?
Yes, yeah, we currently have 9 responders within our little group at the moment.
No, and you cover off lots of the villages as well as Raunds.
We do, yes, we cover a wide variety of villages and areas as well.
I guess, Georgina, you cover, again, you're based in Raunds, but people are eligible to come to you from wherever, aren't they?
Absolutely, yeah. There's no set limit of where they can come from.
No, and you mentioned earlier on about people don't need to come via a GP; they can contact you directly.
100%. They're more than welcome to bring themselves in. If we feel that their care needs to see the GP first, then we'll always write to the GP and refer that customer to the GP first, and then work with the GPs to follow on and make sure that treatment is 100% safe.
So there's a strong link between you and the local GP service.
Yes.
Yes, yeah, it's actually very important. I hadn't realised that. So in terms of going forward, so we've understand from Georgina that everything there is very carefully prepared now, a lot of hard work since the 23rd of March, and that the doors are open for everyone who wants to come, and people can come directly to you. So what about going forward from now? Have you got any, I was going to say a message really to give to people, or a bit of guidance around what they should do?
I'm more than happy to see people. I do 15-minute free appointments, so people, if they're not sure, they're welcome to drop in and sort of talk to us. It's always best to book an appointment, because I have so much time out of the diary at the moment for cleaning purposes. I'm really, really stuck for time at the moment. So it's always best to give us a ring, but you're more than welcome to come and drop in, and we'll talk about what's going on and how I could potentially help people. So osteopathy often looks at sort of the pain from arthritis. It looks at sports injuries, it looks at things like sciatica as an example, and it's a system of medicine that works through where it's coming from originally, and then how we can make little changes through that person's lifestyle to help them improve what's going on.
Oh, good. That is really useful, and especially a list of potentially the sort of concerns that if we have it, they're relevant to you, because there are so many various aspects to health. So that's really important. Thank you. So going forward then, Sonia, what have you got a message you want to give on behalf of the first responders?
Yeah, just if you do need an ambulance, then please call for an ambulance. The staff will be fully protected in PPE. You have no worry. As a group, East Northants, we have set up Operation Shock, and our aim is to raise £20,000 over 3 years to install defibrillators across East Northants, in particular the rural towns and villages, to improve the survival rates from cardiac arrests. This amount of money would make it possible for us to purchase and install approximately 15 defibrillators. And we have a GoFundMe page set up on our social media. So if you could spare any donation, we would absolutely be delighted and help save lives as well. We are also always actively looking for new responders. So if you feel this is for you, then pop us an email and we would love to chat.
So what would be involved in becoming a volunteer? What would be the commitment in terms of time, for example?
So they ask, the East Midlands Ambulance Service asks for 200 hours a year. So this can equate down to 4 hours a week as a minimum. And
that 4 hours a week, that can be quite flexible, can't it?
Yes, definitely.
Yeah.
Yes, yeah, very flexible. Yeah.
So just tell us a bit about how that works. I know that you have to log on or something when you're available. How does that process work? Because then people can fit it into their life, and their obviously everyone's job is sort of changing, but it might bring an opportunity to people that might previously thought they hadn't the time. So how does that work?
Okay, so yeah, like I just said, the hours are very flexible. So if I can log on from my home address, or I don't know if you've seen, we have a little responder car. We can log on in the car as well. So once you've done your training with East Midlands Ambulance Service, you would then receive a login PIN, and we literally contact the desk and let the desk know that we're available and we're on call. If a 999 call comes in while we're in that area, then we will be dispatched to it ahead of the ambulance. So
really, it presents somebody with an opportunity to learn a whole new group of skills, meet new people, and actually make a very worthwhile contribution to the community. I think it's
definitely, definitely, it is very rewarding, very rewarding.
Good, it's good to hear. So thank you very much for giving us some time this morning. I think the people living in Raunds will be interested to hear more about what you do. So thank you very much.
You're welcome.
Thank you.
I would like to thank Georgina and Sonia for taking part in the podcast today. We have solved some of the mysteries of osteopathy and been reassured that every effort has been made to make the premises for the treatment as safe as possible. It's also important to know that the first responder service has and will remain constant, whatever the circumstances. It's about the community supporting the community. We're fortunate to have an osteopath in Raunds and also the volunteer first responders, and we are grateful for all that you do. Thank you.